All right, guys, so just got to Dr. Panine's office and super excited to do this 3-month. Just let me make sure they don't have anyone here. Don't want to interrupt. Nope, no one's here, so we're good. All right. Hey, guys.
Hey, Brian.
Hi, Brian.
How are you?
How's it going?
How's everything going with you?
Good. I'm going to hand you guys the camera. Let's find out.
Let's take a look. Have a seat. Let's take a look and...
Take this off.
Yeah, you can take it off. You don't need it on, actually.
Lost some weight.
I'm gonna take mine off too.
How you doing?
You lost some weight and
A little
you
bit.
got some hair starting to grow now. And
Yeah, started working out 2 weeks ago.
how long ago? When did we do your procedure?
It was July 10th. I got home around like 11 o'clock midnight, so it's exactly 3 months and like 12 hours.
Yeah, well, that's actually when the hair actually starts to grow. When did you notice them starting to actually grow? How long ago?
About 2 weeks ago, actually. So I was pretty excited. So, and that's a little sooner than you said typically, but that's perfect. And yeah, I don't know. I'm pretty excited. I mean, I know it's just beginning, but
Yeah, I mean, this is
it's already starting to see the line.
early stages right now.
Yeah.
You're gonna notice every couple weeks it's just starting to fill in more, and the hair's gonna start growing more, and it'll look more mature. And actually, in about another 3 months, so at about the 6-month mark, is when you're gonna get a lot of compliments. People will be saying
Nice.
that you look different.
Right. 6 months it's an inch, and then it keeps growing 12, 13 months after the procedure.
Let's see your donor area. How's the back healing up with you?
Really well.
Yeah. Wow, you've got it actually long. Have you cut it short recently or no?
I buzzed my whole head at the like 5-week area, 6-week area.
I mean, it looks
Looks super good.
You could go down to probably a number 1 or 2 guard now,
Cannot really
and
see
you wouldn't even really
anything.
see
yeah.
anything back here at all. Might be just slightly a little red still, but not bad, and that'll all go away.
Yeah, redness is temporary. Yeah,
Yeah.
looks fantastic.
Yeah, and there's still some actual baby hairs growing in there too.
Yeah.
Coming out of the skin.
No, it looks really good for
Looks
3
really
months. Yeah, you can't even really
Yeah.
tell anything at all.
Weeks.
And have you been doing anything out of the ordinary or no? Just
Biotin, vitamins, typical stuff. No
Okay.
finasteride. I do
No.
minoxidil right
you're
now.
using okay. How
I am.
are you doing that twice a day?
Once minimum, twice most of the time, and
Okay.
then I am actually also, yeah, pretty much. That's pretty much it. Like just vitamins,
Okay.
natural stuff like that.
Well, you're through that ugly duckling stage
Yeah,
now. That,
almost fully there.
yeah, I mean, have you been seeing any pimples at all anymore? Or
I had a
those all
couple when it like
pretty going?
I'd say month. There's a couple like bumps, but like ingrowns, but nothing crazy. Nothing discomfortable. Nothing that's like.
Did we
bad.
call in that prescription for you for 'em?
You did, and I
Okay.
haven't had to use it yet.
Okay.
Oh, good.
When I called you originally, it's because I had like 2 that were right here, and one actually had a white head,
Okay.
and it popped when I put my hat on,
All right.
and that's when I called you. I was like, oh, that's not good. So I,
Yeah.
and then, but it was only like that one.
Well,
And it
that's
was like,
normal. You still might see some pimples come and go over
Yeah.
the next couple months. That's just normal. It's just a little bit of an ingrown hair, and they'll actually come through. But use that prescription that we called in for you if you
Yeah,
notice them at all.
we'll do.
Any questions at all for us?
No, I'm excited for month 6, and
That's going to be the big
That's
one.
gonna be a big one.
starting to
yeah.
be able to see the line of what it's gonna be is nice.
Yeah.
That's really cool, actually, because I had no hair here and no hair here at all.
Right.
Yeah, look straight. Let's see. So you can kind of see the definition of your hairline starting to
It's starting to come
take
in,
shape now.
Right. Like a Polaroid.
and
like
it's
an old
super
Polaroid picture.
super short. So
Uh-huh.
obviously.
How about the feeling on your scalp right now? Is it all pretty much come back? Or
So
you notice
here
any...
in the front, it
Uh-huh.
seems to have come back. There is
Okay.
some numbness up here in the middle still.
Okay.
It will come back. It
Yeah,
will come back.
so that area is still numb, but the rest is coming in nicely here.
How about the donor area?
Yeah, how about back there?
It feels fully fine.
Uh-huh.
Yeah, that looks. It's the mobility is back, so this is pretty much healed.
Yeah,
Yeah.
good.
Yeah.
Good job.
Glad you're happy.
Good job to you. Like I did the surgery myself.
Well, some people don't take as good care of it as you did. You know? I think
I tried.
You were
Good patient.
detail oriented.
I did what I could.
Yeah.
Although it was pretty easy.
Okay. Well, we'll want to see you again in another 3 months, and then we're really going to see a good difference out
Yes.
there at that
Yeah.
6-month mark, and then it'll just keep getting better for up to 12 to 15 months from when we did your surgery.
Perfect.
All right. No
First, you
questions
guys-
at all?
Let me think for a second. What's going on, guys? Welcome back, and we are home now. Obviously, after the 3-month update, pretty excited, guys. I mean, as you heard, this is beginning stages. We're less than like 20% of the hair growing through the skin. As you can see, there is still some areas that are really empty, and this is because the hair hasn't come through the skin yet. I'm hoping by next month for a lot more of the hair to come through. But again, even at like the 4-month area, everything on the internet says that you're at like 30% of the hair popping through the skin, which doesn't even mean long. It just means like little stubble coming through. So hopefully by then we'll have a lot of hair that's like a 1/4 inch, 1/2 inch long, and it'll look really nice. I think it's starting to look good already. I'm really excited about it. I would say I started to get excited about my hair at about 2.5 months when I started realizing it was coming through. A lot more stubble was coming in. And that is awesome because the first 2.5 months sucked, losing your hair, and like it gets worse than before. And now I feel like at month 3, my hair is actually better than it was before the surgery. Even though it's much shorter, I feel like I have a lot more hair. And my hairline is finally back because, as I said, I had no hair here. And I was just brushing my hair to the side, you know, like that to cover it. And yeah, it's going to be great to not do that and to actually be able to style my hair again in a few months. I'll probably get my first haircut at month 4 or 5, depending on how much grows in. Obviously, some of this hair on the top will get really long. I mean, it's already starting to get like, you can kind of see it popping up like a 1/2 inch in some areas. So depending on how much longer and how much of it is long, I might buzz it myself, or I might just go get a real haircut done downtown. But that being said, guys, thank you so much for watching. Please stay tuned to month 4 update. Also, actually, before I do go, I do want to give a big shout out to Dr. Panine, and I'll probably do this in another video specifically, but he is amazing at follow-up. I mean, anytime I've had a question, I've been able to call him or text him, and his people have gotten back to me immediately or answered, and he'll call me before he goes home after his surgeries that day, which is awesome because I know he has to have a long day when he works. Some of those surgeries are 14 hours. That's insane to be like, hey, let me follow my patients after that. That's awesome. It's great work ethic. And also at the same time, he does every 3 months for his patients. So to get the follow-up every 3 months is really nice because I've watched tons of YouTube videos, talked to tons of guys who had hair transplants, and the common thing I've seen is that their doctors do their hair transplant, they do the 1-day follow-up or 1-week follow-up, and then they don't hear from them again until like 1 year, if that. So to be able to have someone follow me every 3 months and on a regular basis, it's really comforting and nice, and I think that's very important. You should find that in whatever doctor you work with. But again, I'll drop Dr. Panine's info in the description below. So if anyone has questions, feel free to hit them up and ask them the questions, or ask me in the comments, and I'll answer if I can. But thank you so much again for watching, and I'll see you guys in a few weeks. Peace.